joining us today and for your support. And now I will introduce today's guests. Ladies and gentlemen, what can I say about Canadian healthcare that hasn't already been said? Its praises have been sung the world over, and so too have its pitfalls. How best to ensure effective, universal, sustainable, and affordable healthcare is one of the most hotly debated questions on our tongues, and will continue to be for a while to come. I, for the moment at least, will leave the diagnoses, prognoses, and prescriptions to the experts in the room. The experts of whom I speak are among the most gifted and devoted leaders Canada has to offer, the kind of leaders organizations from every sector would die to have at the helm. Thankfully for us and for our families, they chose healthcare. Today you will be hearing from three very talented executives who are making a tremendous impact at leading institutions in the country. They'll discuss not only their careers, but how their special leadership styles, their unique understanding and long-range vision, are bringing about a new era of caring, accountability, and service delivery in our hospitals and caregiving institutions. Janet Davidson is President and CEO of Trillium Healthcare in Mississauga. Janet has a staggering list of accomplishments, awards, and credentials. She has worked and volunteered in healthcare for over 25 years in Alberta, British Columbia, and Ontario. She now oversees one of the largest and most respected community hospitals in the country. Mary Jo HADDAD began her career as a neonatal nurse at Children's Hospital of Michigan. She's been at Toronto's own SickKids for over 25 years in several pivotal positions and has been its president and CEO since 2004. Mary Jo holds many board and chair positions and lectures at the University of Toronto's Department of Health Policy, Management and Evaluation, and at the Rotman School of Business. Dr. Catherine ZAHN is President and CEO of the Centre for Addiction and Mental Health. CAMH has become an undisputed world leader in restoring dignity and vitality to people affected by addiction and mental health issues. Like our other panelists, Dr. ZAHN's 25-year career is marked by outstanding accomplishments. A skilled and widely researched administrator, she is also a neurologist. Her leadership in everything from hospital integration to technology assessment and stroke care has contributed enormously to improvements in care, facilities, and treatment. We are honored to have Roger Martin, Dean of the Rotman School of Management at the University of Toronto, as our moderator today. Known to many as the King of Cool, Dean Martin doubles as one of North America's foremost authorities on business design, integrative thinking, and social innovation. We are thrilled to have him here today. And ladies and gentlemen, I would be thrilled if you would join me in welcoming our four special guests to the stage.
Well, thank you very much for the introduction, and I am looking forward to this. I'm lucky to be on stage with three such talented CEOs. What we're going to do by way of format is each of them are going to say a few words to get us going, and then we'll have a conversation based on what they've talked about, and we'll save a little bit of time for a couple of questions at the end. So with no further ado, Janet, can I turn it over to you to get us started?
Well, thank you very much, Roger. I thought maybe I'd give a brief history of women's leadership in healthcare. From my point of view, though, I don't think this should be about gender. Quite honestly, it's about leadership, not gender. That being said, of course, I have taken the opportunity to say a few words about women in leadership positions in healthcare, not just in this country, but around the world. First of all, women have been around a long time, women leaders. Florence Nightingale, believe it or not, introduced the concept of a hospital to begin with. The healthcare industry itself is populated by women. They make up the largest proportion of our workforce in healthcare, and they now make up the largest proportion of students enrolled in healthcare programs, not just in Canada, but certainly in the developed world. Women make up slightly more than 50% of the population, so to leave them out of the leadership ranks, in my view, seems a little bit short-sighted, because you're actually depriving yourself of 50% or more of the intellectual capital that's available. Women are also major leaders in healthcare in this country, and have been outside of Ontario. They actually lead or have led the largest health systems in the country. So starting from the west, you'll look at Ida Goodrow, who led a $2+ billion system in Vancouver, Linda Cranston in Vancouver as well, Sheila Wetherill in Alberta. We have Maura Davies in Saskatoon. We have Halifax, QE2. We have Eastern Newfoundland. So these are all led by women. We have the largest medical school in the country, University of Toronto. Dean Whiteside, Kathy Whiteside, I believe, is here today. She heads up that program. And more recently, the Institute for Healthcare Improvement, Dawn Berwick's replacement is a woman. And the head of the Center for Innovation in the NHS is also a woman. So I think we do play a very strong leadership role in healthcare. But I always, just in closing, I'd make the comment that one thing that's always struck me is somehow we never feel the need to say a male CEO. But when it comes to a female, we always usually have the gender in advance of that. So I'll shut up there and move on to
Thank you, Janet. Catherine.
Thanks, Roger. So it's an absolute pleasure to be here. My assigned task was to talk about our opinion of the characteristics of a powerful leader. And as Janet pointed out, we also decided that we should speak about them without qualification. Leaders, period, full stop, no asterisks. So I'll start with an anecdote. Several years ago, I was sitting in a forum like this, and my table mate was a retired U of T professor. And he explained to me that he had for many years been in the position to hire leaders, to do searches, and make leadership appointments. And his opinion was that there are only two qualities that are necessary for great leadership. And they were robust, good health, and thick skin. We reflected on that as a group and decided that while those characteristics were necessary in healthcare today, in the complex, complicated world of fast-moving healthcare, they were probably necessary but not sufficient. So the complementarity to that is that I want you to believe that healthcare leadership, like all leadership, has some very specific characteristics. And in its brief form, it's driven by values, it's guided by vision, and it encompasses a small number of characteristics that are important attributes of a leader. The three that I'm going to argue are the most important are, first of all, skilled communication, the ability to be articulate in public and on a one-to-one basis, but also to hear, to be empathetic, and to be able to use your intuition to make the appropriate connections in that cycle of communication. The second is perhaps one of the most important concepts, and it's almost the partner to a good communication, and it's the concept of being self-aware and in control, the ability to understand your emotions and to modulate them and to use them for the good. And lastly, the concept of creativity, the idea that it's important to be flexible, both cognitively and emotionally, to be open-minded, to see the world as continually wondrous and full of possibility, and lastly, to reject the aphorism that if it ain't broke, don't fix it. If something's working well, take it apart, dissect it, make it better, and duplicate it.
Wonderful. Thank you very much. Mary Jo.
So let me build on that and talk about the future leader in healthcare. We heard a little bit about complexity. We heard a little bit about Canada and how proud we are of our healthcare system. And we think about what's facing us today and perhaps what will face us in the long term. So what should the future aspiring leader in healthcare be thinking about? There's no question that as we think about complexity, healthcare, in our opinion, and I think in many opinions of the people who sit on our boards, truly is one of the most complex organizations that anyone will ever lead. And I say that from the perspective of what we expect as Canadians from our healthcare system, what we expect from each other in terms of leadership and what that means and looks like. When we talk also about that next leader, so the leader, the successful leader of today, the successful leader of tomorrow, it's about vision. It's about sticking with your values, staying grounded on those values. It's about recognizing that through our education and the opportunities that we're afforded in our country, that we can't always think about what's the next job going to look like, or I aspire to have this particular position. So I think mentorship and coaching is a privilege that we hold as leaders. It's also an expectation that we hold of ourselves in ensuring that the leaders of tomorrow really understand what leadership is about, not just leadership in a hospital, but leadership in healthcare, leadership in complex organizations, where people today demand more than they did yesterday and will absolutely demand more tomorrow. That's on understanding. So what are those attributes? It's about knowledge, there's no question about that. It's about, again, having a passion for what you do and finding what that skill is. And as Catherine said, knowing who you are, staying thoughtful about that and taking advantage of the learnings that come your way. I think also as we look at mentorship and coaching, they're words that are often overused. So clarity about what truly is mentorship and how do we as leaders think about leadership. It should probably be one of the top 3 things on our agendas as hospital CEOs or as leaders in the sector, because our obligation is to ensure that healthcare tomorrow is greater than it is today. And part of that is ensuring that we're developing the right leadership for the future.
Thank you. Thank you for all of those things to get us started. And I'd love to go back and cover some of each of the ground. And if I can start in the following place, and I'll go back, I've learned about hospitals a little bit as a director of SickKids, and when I got to SickKids, I was confused as heck, and I overlapped with Mary Jo's time as CEO, and Mary Jo will probably remember me asking her about the organization chart. And I sort of said, well, do these chiefs, do they report to those VPs? Oh, no. Well, do the VPs, do they report to those chiefs? No. And I'm like, I'm supposed to be like a management expert, and I can't read this. I can't read this organization chart. And I came to the conclusion from those conversations that sort of the ability, if we use sort of kind of international conflict kind of terms, the ability to use hard power to get things done in hospitals is about 0. And it's all about exercising some kind of soft power in that complex organization. How do you? Well, first of all, one is that kind of more right than wrong, and how do you develop that skill to manage these organizations where sort of nobody really seems to report to anybody, and all the while, people are going to die if you don't do it right. So there's massive pressure and not much clarity. How do you develop your skills to manage that?
So can I take a stab since you started with SickKids? We all know what we're doing.
Yeah.
And
I noticed that.
But I think really important points around how do you manage in such complexity. There's no question that structures should enable you to get the work done. And if you peel back the onion, and I commented very briefly on vision and direction, and any complex, successful organization needs to have clarity and focus on what are we all there to do. So part of this, I think, is really articulating clearly a vision and organizing yourself in a way, however complex or simple healthcare organization is that you happen to lead, organizing yourself in a way that it's clear to people why they're there, it's clear to people how the vision, the priorities one sets and the values that one articulates affects them in their day-to-day job. And then those structures, and if you look around each hospital, each healthcare organization, they're somewhat different. Because a big part of hospitals have been around a very long time. Yeah. A big part of hospitals is culture, and a big part of hospitals is understanding what it's going to take in that particular organization to make a difference.
I agree with everything Mary Jo said, but I wouldn't want people to walk out of the room believing that there's no structure in terms of how we take care of people, because at that level there is actually a significant amount of structure. But as Mary Jo pointed out, where it becomes a bit more ambiguous is when you have to deal with a number of characters that have different roles in the organization that are more than matrices. One person can report to another in one role, and it can be the opposite in another role. It becomes that idiosyncratic. But the leadership characteristic that's necessary is again, very, very simply leading from your vision and your values, but also having a great deal of comfort with that level of ambiguity. And I would say that compared with a more structured industry, what it means on a day-to-day basis is it takes a lot more time. There's more relationship building and more attention to the factors that allow you to be influential as opposed to command and control powerful.
Yeah, I mean, I certainly would agree. I think the critical thing in healthcare, well, there are probably two things. One, as Mary Jo said, there is a structure, but it's more there to actually help you than to be kind of rigid, to say so-and-so reports to who. But I think it's the fact that healthcare really is a people business. I mean, we often hear talks about healthcare and we see the latest piece of equipment and the latest building and the latest whatever it might be. Those are important, but they are, at base, healthcare is all about a relationship between an individual and either the patient directly that they might be providing care to, or people who are supporting people giving care. So Catherine made a comment earlier about one of the attributes being good communication, interpersonal skills. It is absolutely essential. But although the organizations are complex, at least in my experience, one of the things that's a constant joy to me and a reassurance is the fact that 99.99, like ivory soap, % of the people who go into healthcare go in it because they actually want to make a positive contribution in the lives of other people. Whether it's somebody working in the finance office, whether it's a rehab specialist on an inpatient unit, whether it's a physician in an outpatient clinic, doesn't matter what it is, they all actually are driven to provide the best thing that they can, care to patients. And so when you have that actually allows you to get around a lot of stuff that you might not be able to do otherwise. So in some ways, when you create a vision and you have a vision that people can align around, there's very little disagreement about what the purpose is that you're trying to achieve.
Yeah. So I hear three people who are incredibly comfortable with complexity and ambiguity, and that's probably why you're fantastic CEOs. How did you get that way? What's the development path that gets you to that? Because I mean, I would probably argue that there aren't lots of whatever training programs on complexity and ambiguity. There probably need to be more. Are there organizational structures within your organizations that promote people learning those skills? But how do you get, I can understand the idealized state that you want to be in, which is being able to handle that, but in most organizations, right, most of the time, they have a great difficulty in dealing with those two things. And so they create, most organizations create structures that I think are too rigid to get rid of ambiguity and complexity to their detriment. You guys are saying we absorb it. We just say that's the way it is. How did you get that way? Catherine.
Well, I think it's a combination of, I think, probably your genetic makeup, your background, and your life experiences. And I explained to people that I've actually had a fairly easy life. I have no particular wounds to heal, and so I can bring all of my emotional energy to the job that I have to do. But there's also a certain thinking character that is different in people. I'm by trade a neurologist, and when I'm asked why I chose that, first of all, I never know exactly how to answer. But when I do answer, I say it's because it looked like a puzzle to me. It looked like an area where I could use my problem-solving skills and the things that I knew about myself. Again, that self-awareness and ability to control my directions, to develop those skills. And then I think probably all of us just simply have more and more experiences where those behaviors and skills work, and you gain more confidence and more comfort with it, and it continues to build.
I think there's also, if you think fundamental to healthcare is the relationship with the patient. And how complex is that? It's at their most vulnerable state, especially when they're in an acute care setting, and then when they're leaving and they're going into back into the home, and that relationship is even more complex. So if you really think about what is fundamental to our roles as healthcare providers, it really is the complexity of that relationship. So I think part of this is also about our grassroots. Where were our experiences? So nurse, physician, you really understand the complexity of a relationship, which really it brings a whole different dimension to the way one manages in a sense, a one-on-one, or one manages within a team who are all there, sometimes tripping over each other when we don't have role clarity on how does one deliver on that. And then I think you take that up into a much broader organization, and if you have the fundamental underpinning of that understanding, it makes this a little bit, I'd say a lot more manageable.
Yeah, I mean, for me, certainly the fact that I've traveled around the world and done things in healthcare, I think has been an advantage. And the fact that I look back now and think my experience in the government of Alberta in healthcare was very valuable, because you certainly do learn to be a pragmatist, about what you can achieve and what you can't achieve. And so I think I've always been interested in challenges and changes, and so I think that does give you, I think it probably provides you with a better grounding for managing in healthcare, which is not easily definable, as you said earlier, Roger. But I think it certainly helps in the environment that we're in now.
I'd say, Roger, also that it's a combination of two concepts. One is being optimistic, and the other is being fatalistic, as Janet pointed out, understanding where you can move things and where you have to accept what's put before you.
And working with other CEOs, I think, and certainly I've made it a practice to develop a kind of a group around me that I can talk to. Some are CEOs, some are mentors, and people who've been important to me over my career that I think have been able to provide me with a perspective that's allowed me to handle some of this a bit better.
Can I go to creativity? You mentioned that, Catherine, and in my experience in lots of companies, they'll make an excuse about, lots of companies are scared of being creative and creativity, and so they make an excuse, well, it's tough economic times, you can't be creative now, when everything goes fine, we'll get creative, and it's a lame excuse, but I could well imagine, right, in a hospital setting, lives are on the line. There's no time when there's not serious, difficult, challenging issues. How do you spur a culture of creativity in an environment like that where everything's immediate and you've got to do things well, and lives are in the balance?
In a simple way, that's painting the picture of what the endpoint should look like in a time of difficulty. And I think most theorists on this would understand that most creativity blossoms in difficult times, not in the simple times. So setting the challenge before your team and putting out the call for new ideas. In all of our organizations, I think one of the common ways this plays out is with respect to our budgets. When we have a challenge, when we have a financial challenge, our goal is to take care of as many people as we can within the envelope that we have available to us. And so the challenge goes out to our team, to our physicians, to come up with ideas. And I'm never disappointed. I've never been disappointed by the ability of a lot of smart people in healthcare stepping up to the plate and understanding that it's a risk-taking organization, and that means that sometimes things don't work out. You go back to the drawing board and circle back. You can accept process failure. You just can't accept outcome failure.
Well, and certainly from my perspective, I mean, being able to encourage creativity has never been a challenge. It's, you know, how do you manage the number of creative ideas that come forward in a reasonable way? I think that's, again, the really positive thing about healthcare. Because people want to do the absolute best they can, they're always on the lookout. What's the latest information? If it's a clinician, they've read the latest literature. If they haven't, you can be pretty sure the patients have when they come in with everything they've downloaded from whatever website they've been on. So there's a constant quest to be out there, to be learning, and to come up with new ideas. So I mean, maybe it's luck, maybe it's the organizations I've worked in, but I've certainly always found creativity to be something that is that's always there in spades.
I think also if you're talking about individual creativity, it's somewhat different than talking about a culture of creativity, a culture of innovation. And I think one of our biggest challenges is we often take that for granted. The focus on what is your culture, what's happening at the grassroots of your organization. And you know, we've spent at SickKids a lot of time on this over the last year because we're known for being innovative. Well, what is it about us that's innovative and what's not? We're not innovative on everything. And how do we really think about it and talk about it? And what's the language that comes from leaders? So it's instead of saying we don't do it that way or that's not the way we do it, it's how do you really change the dialogue? And I think that the future success of healthcare organizations is innovation, is thinking about things in a very dramatically different way. Not about chaos and having one person in each area doing things differently, but really understanding. And I don't know that we understand innovation well enough, especially in healthcare. There are phenomenal creative things that go on, no question about that. I mean, we have a great healthcare system and delivery because of the innovative minds of our scientists, the innovative minds of practitioners, and learning from our experiences. I think if we can figure out a way to be much more focused on what have we learned from that and how do we create stronger cultures of innovation, we'll be in a much stronger place long term.
I'm going to ask one more question of each of the three, and then I'll put it out to the audience. It sounds like you've all been in the healthcare system for somewhere around the same amount of time. As you look back on what things were like and what sort of people were coming in at that time versus now, what do you see as differences in the folks who are entering your system at the bottom of the system, the youngest, the apprentice level, if you will, versus when you were entering the system? And what do you like better about that situation now, and what do you like not as well?
Yeah. So great question. You know, people entering today are much smarter than we were. People entering today, I think, are much more thoughtful about what it is that they want in a broader world. You know, I mentioned globalization, and again, it's another word we all use quite often. What does that mean and look like? the people we're working with today are very different from the people of the past in that they've traveled the world, they understand healthcare in a broader context, they want to make a difference not just at the bedside, not just in your organization, but in a much, much broader sense. So there's the notion of the world at their fingertips. I think there also is a big challenge in our systems. We're looking at many generations of delivery, right? Anywhere from a 22-year-old to a 75-year-old, and all that brings. And when you're talking about the delivery of patient care and the burden that has on the mind, on the body, and on the soul, it does vary from generation to generation. We need to be very thoughtful about how we lead the complexity of our organizations against that.
When I first walked into a hospital, I understood that it was my job to carry out the day-to-day work of patient care, completely oblivious to the significant infrastructure that was supporting me and completely disconnected to the broader healthcare system. I think that's quite different today as well. If young healthcare workers enter the system without those bits of information, it's introduced to them very, very quickly. And again, my experience is that they respond to that broader approach to healthcare.
I think when I entered as a student nurse, I mean, I think there was a fair bit of hierarchy. There wasn't a fair bit, there was a lot. It was fairly hierarchical, and nurses knew their place, and it certainly wasn't going to be the top of anything. It was a different world then. I think the positive thing now is, as Mary Jo said, I mean, people come into healthcare, whether it's nurses or other clinicians, that one have a much broader expectation of what their role could be. And so it's not really limited by a particular activity that they might be doing. But the other thing is they actually expect a lot more of their employers. I mean, when I came in, I would be, whatever the employer was offering was really what I expected. They formed my expectations for me. That's not the case now. Our new staff members are really very strong in advocating for what they think is important. And I don't mean a salary. I mean things like, okay, are you going to develop me? Are you going to give me opportunities for learning? Are you going to expose me to, as we talked about, complex environments and ambiguous environments? So it's a great learning experience because it's quite a different group.
Terrific, thank you. There is a roving mic. If you put up your hand, we can probably have one or two questions before anybody had a question. Way back there. And was there another one over here? Is there one? Okay, great. And tell us who you are.
My name's Lynette Manderson, and I work for Shoppers Drug Mart Specialty Health Network. And I guess my question is in regards to the relationship between the public and private sector. And I'm wondering what characteristics that you see in leaders within the public sector, how they would benefit in the private sector, and vice versa.
Say the last part of your question again.
Sure. I'm wondering how the benefits of a leader coming from a public sector would benefit the private industry and vice versa.
I think we've had a tradition of learning from each other, from private and public sector. And I can recall very early in my career an opportunity to step out of the hospital. And I think that at the time the vision was, or the thinking was, there's lots to learn from the private sector. Go on out and learn from the private sector. I would challenge today, there's lots to learn from the public sector. And I think there's lots to learn from each other. And those partnerships and understanding, both from a complexity of organization, the way we do business, understanding, again, from the private sector, especially if you have anything to do with the healthcare field, really understanding what's at the core of both delivering care, the discovery of new knowledge within the construct of research, perhaps. There is lots to learn from each other. It's a two-way thing.
I would say the same. In fact, I mean, one of the things I often talk about is the fact that people, if you're going to spend your whole career in healthcare, you should actually get experience in a variety of sectors. So, for instance, hospitals, that's fine, but we manage patients for a relatively short period of time. These individuals come from the community, they work in the community. So what about doing some time in public health? Government, if you don't understand how government works, you're severely disadvantaged because they're the biggest funder. They set the policies that you have to follow. They think like no other group thinks, and I'm not saying that in a negative way. It's just that they're a different sector. So I'm saying get some experience there. I'd say the same thing with private sector and vice versa. I think you bring all of those experiences, bring a much broader perspective when you're trying to manage and lead in healthcare.
The reciprocal nature, though, is a really important point. I mean, typically we would have imagined ourselves to look to the private sector in the areas of efficiency and customer service, quality, but the public system has become quite adept in those realms as well. So that give and take concept, that learning about all aspects, public, private, civil sector, are really critical.
Thank you for the question. In the interest of time, I think we need to draw to a close. We were supposed to talk about women leadership in healthcare, and I sort of steered more away from that because I wanted to hear from these three great women leaders in healthcare what was on their minds. I did, however, hear that it's really important to be highly self-aware, be in control of your emotions, be very much into mentorship, into relationship building, having a productive combination of optimism and fatalism. And so what I come away thinking is that if men really work hard, they've got a chance to be CEOs too. Thank you for your insights. Those were all terrific. Back over to you.
I'd like to call Helen Bernstein, past president of the Canadian Club of Toronto, to the podium.
Well, thank you. It's my pleasure to thank today's guests, and let me start by thanking our panel. This has been a fascinating discussion, and we are very fortunate at the Canadian Club to have had with us three intelligent, insightful, and inspiring people to provoke new thinking and challenge some conventional wisdom. So thank you, Janet Davidson, Catherine ZAHN, and Mary Jo Haddad, for joining us today and sharing your thoughts on leadership, healthcare, and to some extent, the unique role that women are playing in those arenas. And a very special thank you to our moderator and provocateur, Roger Martin, Dean of the Rotman School of Management. Thank you, Roger, first of all, for agreeing to take on this daunting assignment in the first place. And you've proven yourself more than capable of engaging three powerful women in a lively, frank, and elegant discussion. And the final thanks goes to our audience, and I'll turn the podium back to Nick Chambers to do that.
Thank you, Helen, special guests, and once more, Ernst & Young for making today possible. This concludes our television programming, which has been broadcast live on Rogers TV. We are grateful to Rogers TV and 680 News for their continuing promotion of Canadian Club events. This meeting is now adjourned.